Coming up today, before accepting that he needed open heart surgery, Kenny Karczewski went in search for a second opinion. We follow his path to new options inside the operating room. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Kenny Karczewski had a heart murmur, but he refused to believe that open heart surgery was his only option. And as Alexis Del Cid explains, it wasn't.
Kenny Karczewski was stunned when doctors not affiliated with the University of Kansas health system gave him some startling news.
They told me that, yes, I would need open heart surgery and possibly, based on my body size, body mass and all that, probably a couple of bypasses.
Not only that, but Kenny says those same doctors said he would likely need a heart transplant.
And I quickly said, well, I'm going to probably need a second opinion on that before somebody cracks me open.
It's a good thing he got one, because that second opinion that he got right here at the health system ultimately led to a fantastic change in diagnosis.
I was not in need of a bypass or anything. It turns out, shockingly enough, that my arteries were not clogged.
And that heart transplant, also unnecessary. Kenny says doctors here at the health system proposed fixing him with a special robot. No cutting him open, and he'd be home within a few days. To that, Kenny said he was all in.
And we are so glad to have Kenny joining us this morning, along with thoracic surgeon Dr. Omar Almograbi. Dr. Almograbi did not treat Kenny, but he does perform this procedure quite often. Doc, good to see you today.
Good morning.
Kenny, great to see you as well. Day after 4th of July, how are you doing? Are you hanging in there?
I'm good. I am.
Thanks for getting up early with us. We really appreciate it. First of all, just how are you feeling? How are you doing?
Pretty good. Fantastic, actually. You asked earlier, and I've lost 32 pounds so far. I mean, I'm doing everything for the most part that I'm supposed to do to ensure that I have a good, successful post of what they've done for me on my repairing my heart valve.
Well, good. You said fantastic. I guess we can't ask for anything better than fantastic. But before we go into this procedure, kind of give us a little bit of a brief history of your heart health. How did we get to today?
Well, I mean, they diagnosed me in 2018 with a heart murmur, and they just said they had to keep an eye on it, and it just progressively got worse. And I kind of, COVID came around. I let things go. They let things go. So, it was a mutual thing. 2022, I had my second test done. Things kind of sped up from there. And then 2023, things really got serious. And the beginning of 2024 is when I found out that they wanted to basically open me up and either repair or replace my mitral valve.
Yeah.
As you guys know, with the rest of the story, I got a second opinion, and the KU people were fantastic.
Well,
I mean, from the very get-go.
Well, we're good. We're always so glad to hear that. But I want to go back to a story that we've heard before, which is that you really, once COVID hit, people put off things. They didn't go and get their checkups, and they put things off. And kind of what was that like? I mean, you've been diagnosed with something, but you got to keep up on it and find out where you stand. Kind of how did you navigate that COVID time?
Us males sometimes are hard-headed and I'll just say plain stupid. And, it is more, I would say, more my fault because I didn't push it. I didn't take it as serious, I guess, obviously, as I should have. Yes, I mean, with COVID, there was a lot of things that were put off. I actually put it off as well, but nobody pushed, and it's an unfortunate thing, and that's why I've told a lot of people, get yourself checked, especially a lot of my friends that they've never even had a physical. And, I'm 56 years old. A lot of my friends are older than me, believe it or not, and they haven't had physicals. And I'm like, you guys, some people just don't want to know. You do want to know if you want to live. So, because, if I didn't take care of this, it could have been way worse, obviously.
Right. I mean, you're you don't want to teach your friends to get their health checked with a loss of life. So you're using your story to say, get the word out and say, don't be me. Get checked out. Don't put it off. Yeah. You guys want to stick around.
Yeah.
Exactly. You never know what they're going to find. And so this leads to this leaking, this mitral valve leaking. And I want to bring in Dr. Almagrabi just to say, what does that mean, and what does this valve do inside the body and the heart?
Yeah, so the mitral valve is one of the 4 valves in the heart, and it's located on the left side of the heart. It separates the left upper chamber from the left lower chamber. It has 2 flaps, and what those flaps allow it to do is let blood go in one direction. So it's a one-way valve where the blood moves towards the left lower chamber, and that is the main pumping chamber of the heart, where it allows blood to leave the heart and perfuse the rest of the body and organs. And when it leaks, that blood goes backwards towards the left upper chamber, so it creates this recirculation and inefficiency within the heart. So there's less cardiac output going towards the rest of the body.
So if left long enough and unattended and untreated, what can happen?
Great question. So mitral valve disease can go undetected for a long time, and people can have literally no symptoms until it's at an advanced later stage. But ultimately, what people experience is palpitation, shortness of breath, swelling in the legs, which eventually lead to enlargement of the heart, and it could lead to multi-organ failure, meaning the lungs could fail, the kidneys could fail, the liver could fail, and ultimately it could cause premature cardiac death as well.
So, Kenny, I have to ask you, you went for this second opinion, and you've been really passionate about that. When you heard that immediately, you said, I got to get a second opinion before somebody cracks me open. Rightfully so, but not everybody feels comfortable asking for that second opinion. Why was it so important for you to do that?
It's, life experience, I guess, with other people, for one. I've never heard anybody go, that was pleasant. Boy, I really enjoyed that. As doctors tell you that I think on something like that, you get a recovery of, 8 weeks to 12 weeks or somewhere in there. But everybody I've ever known that's had open heart surgery, they said they didn't feel right for about a year. And so when I think about that and how they were explaining it to me, I instantly was like, this doesn't sound right. I got to get a second opinion. And I always tell her, it was been always told to me, no matter what, find out, because there's always somebody else that might have a different answer, especially with today's technology. And I guess it's just, I don't know, just reading, and I think there's always somebody out there who's got a better answer.
Sure.
I'm not saying it's always the right answer, but in my particular case, it was the right answer.
Well,
and I always tell everybody, get a second opinion, especially when you got I feel blessed in Kansas City as we do have pretty good health care. Everybody's like, oh, go up to Mayo Clinic. I'm like, I don't need to go to Mayo Clinic. There's enough people here that they know what they're doing.
They sure do.
At least that's how I felt. Yeah.
Yeah.
And I know a lot of medical people as well, and they reached out on my behalf and talked to the medical professionals there at KU, and they're like, hey, you need to see this guy, and get these tests done. And it really did go that quick. I was there for a whole day, but hey, I found out what I needed to know pretty quick. It was pretty awesome.
Yeah, it sounds like it. And as we often say here, you got to be your own best health advocate and push for answers and
you got to trust your gut.
Yeah.
And a lot of people don't, and to your point, they don't have the gumption, I guess, to, I'm going to upset that person. Well, the only thing I can say there is I'd rather upset that other doctor, I guess, than myself. Because you got to feel good about who's going to work on you. I've had a few surgeries, so I always trust my gut on who's going to perform it.
Trust your gut.
I've had some good doctors, and not every doctor has a good bedside manner. And with my sense of humor, I can totally understand that. So.
You're pretty hard to take, and I know you. You're a family friend of ours, so I bet so. But I bet they love you. And yeah. I do have to ask you, though, Kenny, what's it been like for you and your wife, Cindy, but knowing that you live with a heart issue, a condition? I think when others hear that, it's like, God, that sounds really scary, that kind of ticking time bomb feeling. But what's it like, and how do you make changes in your lifestyle and your movement, your activity, exercise, diet? I mean, is it something you're constantly thinking about, or is it just you live your life?
No. For me, I mean, it's I'll just use once again back to my experiences. Wow, you get this chance. They fixed me, and through all the tests, like I was telling you earlier, and to find out, oh, okay, this isn't that bad, but it could get bad if I don't take care of myself. So it instantly threw me into better diet, less abuse on my body, and definitely more exercise. And I'm not even, all I'm doing is really walking and doing some weights. I'm not running. I've lost 32 pounds since my surgery. So, I'm going to plan to lose 20 more because I'm doing it every week. So I've seen the progress.
Yeah,
and it does make you want to, for me, it makes me want to keep going.
Yeah.
And because I do want to live, and I still have fun, and I want to keep having fun.
I know, and we want you around for all that fun, Kenny.
Yeah.
And Doc, what's it like when you hear post-procedure like this, Kenny doing the right things, taking his weight into consideration, doesn't have to do rigorous exercise, even just tweaks to the diet, good, solid, consistent walking. What do you say to that, and what other advice do you have for patients?
Yeah, no, that's a huge win for us when we see that the patient is motivated after all the work that we put in. It's a team sport, Part of it really it depends on us and the procedure that we perform, but also lies on the patient, and they have to do the right things to see the most out of that surgery, the benefit out of that surgery.
Yeah, and in this case, you had him for one day, and then you send him home for a lifetime. So you want him to be able to run the race. So if you have questions for today's guest, be sure to ask those on YouTube or Facebook. Just drop those in the chat, or you can email the Medical News Network. The information is right there on your screen. So Doc, there's a huge difference here in treatment plans. What about Kenny's heart allowed him to have this robot-assisted procedure, less invasive, to repair the valve versus this big open heart surgery, which sounds so big and invasive?
Many factors go into that decision, and we brand ourselves here as a heart valve center. What that means is it really starts with our navigators, and it moves on to a multidisciplinary approach where a cardiologist and a cardiac surgeon review almost every patient and kind of decide on what direction to go. And in his scenario, as I mentioned earlier, the mitral valve consists of two flaps. One is called the anterior flap, the other one is called the posterior flap. And the patients that we select for the robot are the ones that have pathology within that posterior flap, and 80% of the time it's right in the middle of that flap. So those are the patients that we select for the robotic approach. But that decision is very complex, and a lot of factors go into it.
Well, just maybe stop. I mean, that's kind of why we're doing this program, to talk about what kind of options are out there. But how would a patient like Kenny at another hospital know to ask? I mean, I think somebody hears open heart surgery, they're like, oh, doctor must know best, and that's the only option. They don't know to do the research.
Right, right.
How do people know?
Right. You just have to ask the right question and kind of be an advocate, like you said, about your own health. And the right question to ask is, what kind of valve issue is this? Is this a leaky valve, or is this a narrowed valve? Where is the problem within this valve, and what are the different approaches to tackling this valve? And also, you have to kind of know yourself. Are you a high-risk patient? Do you have a lot of comorbidities and problems and lung disease and other issues that may not allow you to undergo an open heart surgery, and we may have to do not even a robotic approach, but maybe a catheter-based approach where you go through the groin with really minimal incision. So there's a lot of options that we have, and it's very important to go to a heart valve center that is comprised of several subspecialties: cardiology, cardiologists, and people that see patients like Kenny all the time.
Very specified.
Yeah.
So let's take a look at some video. We like to go behind the scenes here. This video is not of Kenny, but walk us through what's happening and how does a robot assist in fixing the valve?
Yeah. So the robot, there are many platforms, and the platform that we use is called the Da Vinci. It's just kind of a traditional master-slave system where the robot doesn't really do anything without the surgeon. So what you see here, the surgeon is placing the ports. So those are mini ports, mini incisions that go into the right side of the chest. You put in the arms of the robot within the chest cavity, and then here you see the surgeon moving his arms, which translates his movement into precise micro movement within the confined chest cavity. And as you can see, he's setting up himself to visualize the heart better, and eventually the heart will be arrested and then opened. So this is still an open heart surgery. You are still going to go on cardiopulmonary bypass, but the approach is, instead of going through the middle of the chest, you're going through the side. And here you can see the mitral valve head on. If you think about the mitral valve, I know it's labeled as a left-sided structure, but really it's more of a posterior structure. And when you approach it from the side, you see it right head on. And the visualization is phenomenal. As you saw in that picture, it gives you a very high definition, kind of a 3D image, which it's better than the naked eye. And you can see it so much better.
That's crazy. How long has this been an option to treat patients like Kenny?
Right. The first robotic surgery was performed in 1998 with an earlier prototype of this Da Vinci platform. But in 2002, it received FDA approval for mitral valve repair. So since 2002.
Nice. Kenny, you said it took about a day to get back on your feet. First, just tell us how recovery was.
Laps.
You were running laps?
Oh, no. They get you up moving pretty quick.
Yeah.
They want you moving around. Recovery was still, I mean, they say less invasive. It still hurt like hell. But it was after a week, I was already feeling pretty good. Once again, taking it easy, but still, I was home for 3 weeks. And I listened to what they told me to do, and once again, you listen to professionals, and you usually get through it pretty good.
Yeah, it sounds like you
do something silly, and I try not to do anything silly.
Correct. Well, I know it's good. It's hard to listen, but it paid off in this case. So, how long would what it take somebody to get back on their feet if they had open heart surgery? What's that kind of recovery like for someone?
Right. So if we're talking about robotic approach, like he mentioned, it's painful. I mean, could you imagine having a rib bruise or broken rib? That's what it feels like. Every breath you take, every movement you make, I mean, everything, you feel it. So from that approach, from that standpoint, actually, it's not less painful. However, people recover much faster, though. And still, the gold standard is going through the sternum. So not everybody qualifies for this robotic approach. But if you were to have a robotic approach surgery, I would say nowadays we extubate patients, so the breathing tube comes out in the operating room. They go back to the ICU, spend one night in the ICU and about 2 more days on a regular nursing floor. And then they go home, and I would say most people are back to feeling normal within a few weeks, and all limitations are lifted after 6 weeks. Where the traditional route going through the sternum, it could take up to 2 to 3 months before you feel 100%.
Is this something Kenny will have to have done again, or kind of what's the post monitoring like for a patient like Kenny?
Possibly, the short answer. However, the success rate for a mitral valve repair is 95% at 10 years and almost 90% at 20 years. So the chances are that he will not need any further surgeries on that mitral valve. But it's very important that you follow with your cardiologist and primary care physician and make sure that they listen to your heart at least once a year. And, just overall, just have to be advocate again and follow up.
Let's get to some questions from our viewers this morning. And Jean has a question, and I don't know, maybe somebody can look this up in the back, but is this the same surgery that Mick Jagger had?
I don't know.
Okay, I guess. Okay, so Stuart, our producer, is saying he had a catheter-based, but was it the mitral valve that he was getting fixed, or something else? It was a heart valve up through the groin. We're getting all the information about Mick Jagger this morning, but
which we actually offer that as well. Okay. Catheter approach is offered here as well, and like I said, that's why you go to a heart valve center, because every treatment is tailored to the patient and their circumstances.
lots of options. So Jeremy wants to know, since it's minimally invasive, does that make it easier to handle with getting insurance to accept it? Or would it, no reason for it not to be accepted?
No reason for it to be not accepted. People do well, recover faster, and I think insurance look at it as this is an advantage. People leave the hospital sooner. They do better overall.
Did you say mitral valve is hereditary? Like having this issue is hereditary?
It can be. It's both acquired and can be hereditary.
So Carrie was asking, is it something that if a patient has it, that their children should be monitored or checked for it? Does that make them at high risk?
It's a tough question to answer because it all depends on the cause of this mitral valve disease, if it's related to a connective tissue disorder or if it's acquired or not. And if it is a mitral valve prolapse, perhaps, yeah, there is definitely a 30 to 50% risk of family members having it. But there are some genetic testing, but it's not commonly performed. I would say the most important thing is make sure that they get their physical yearly. Make sure that somebody listens to their heart, especially if they have a family member who's had a mitral valve pathology.
We talked about how specialized some of these procedures are. Bennett wants to know what type of training is involved in using this robotic Da Vinci procedure.
Well, I think the first step is to establish a very strong foundation in open approaches. So once you master that, once you feel comfortable with the open approach, that's when you take it to the next level and learn the minimally invasive approach. And for me, really, the first time I touched a robot was back in 2013. And I've had great mentors all throughout my training. But really, it takes a lot of time, individual time, where you go and learn on these online modules and learn how to use a robot. And I also spent some time traveling and learning different techniques and how to operate. But really, all starts with a strong foundation and open approach before you jump to the minimally invasive approach.
Back to like lifestyle changes. Jenny wants to know, Kenny, did you have to give up like any specific foods, or is there anything you had to eliminate from your diet? So kind of what were some of your do's and don'ts once you got home?
Well, I like pizza. I didn't give it up per se 100%, but I don't eat pizza that often anymore. No, it's you know, the nice thing is about the cardio team is they give you a good reference points to whatever you want to tailor your diet to, and you still can eat good food. It's just watch your sodium. The big thing I noticed is they were really concerned about sodium and sugar. So, you know, I've always watched my sodium content anyway, but there's just so many things you just want to do, and just pay attention to what you're putting in your body as far as the sodium side. I think that's even bigger than the sugar. And then just if you move more, you can actually eat a little bit more, but you won't want to. You just eat more or eat less, move more, as they say, and it works.
Yeah.
And I feel better for it.
Good advice.
I haven't really given up that much. I really haven't given up that much. It's just eating smarter.
Good. We talk about nurse navigators on here from time to time, Doc. So, and often when people are entering the cancer world, but Amy wants to know, are there nurse navigators that help people navigate the heart world?
Absolutely. So we have great navigators here at this health system, and they know their stuff really well. And they basically evaluate every patient. They collect all the data, especially if someone is coming in for a second opinion. They get all the notes, they get all the studies, and then they present it offline to one of the surgeons, one of the cardiologists, and kind of discuss the options and then decide on which route to go, and then the next step is taken.
Right, and if people aren't familiar, nurse navigation, as you pick up a phone, I mean, and I think if you're getting news like this, any type of health news, that it's like, who do I call? And I'm going to have to get on the phone with dozens of people, and these nurse navigators take your call, kind of settle your nerves, say, we've got you, we're going to get you to the right people, we're going to start setting up your appointments for
Correct.
you, we're going to get them into MyChart, right?
Absolutely, absolutely. And they do it so pleasantly too, and maybe Kenny, you can speak on that, but they are so wonderful at what they do, and they love what they do, and so I love having them on the team.
Yeah. Kenny, did you have any experiences with nurse navigators and just the other support teams besides your docs?
Great professional group. That's all I can say. They were they got me boom, boom, boom. There was zero hiccups. I mean, it was awesome. It totally makes you feel comfortable when you know that they have you. it's a process, and they don't skip anything, and they're on it, and they make you feel very comfortable with what you're going through, because it could be stressful. I mean, you're being pricked, prodded, escorted here, escorted there, and this whole team they're keeping it all together and keeping you informed, and just really trying to make you feel good about where you're at. And you're in a hospital, so that's a pretty tough gig.
Yeah, it is. It can be overwhelming. As we wrap up today, Kenny, what's the big takeaway? For folks watching your story, what's the big takeaway today?
Yeah, it's as I told your whole team, you gotta definitely get your physicals. I mean, it's a big one. Find a good team, which I did over there at KU Med. Those people are awesome, and treat your body good, because if you don't, it could be really bad for you. And I didn't take some things very serious as I should, and I'm taking it very serious today.
Yeah, and you're not, we hear that story often too. It takes something like this to kind of shake you up and wake you up and make you live life differently. And spoiler alert, because we got a little 2-for-1 with you, because you're going to be coming back on All Things Heart coming up in the fall to kind of just dive a little bit more into this mitral valve issue. And so we'll get to see your face again.
Oh boy, good for you guys.
All right, lucky us, right? Kenny,
that's
thanks.
right.
Thank you so much for being with us today. We'll see you very soon. Have a great weekend and be well.
Thank you.
Doc, what's the big takeaway?
You know, Kenny really is providing a great public service announcement. Mitral valve disease is one of the most common valvular disease. It has an incidence of 2.5% of the general population. So we're looking at least over 7.5 million people here in the USA that have mitral valve disease that goes undetected, and it's certainly undertreated. So just by being here on this segment, just educating people, letting them know that yes, there's a valve called the mitral valve that can go wrong, and sometimes it's acquired, sometimes it's just something that you inherit from your family. But it's very, very important, I can't emphasize this enough, to go get your physical yearly. And if you end up having mitral valve disease, make sure you get seen by heart valve center, whether it's KU or somewhere else. But you want to make sure that they take a multidisciplinary approach to your issue.
And get that second opinion if and when you know you need one.
And unfortunately, his story is not very uncommon in our world. We see it and we hear it all the time. And absolutely, it's okay to get a second opinion.
It's okay to question those smart doctors, right?
100%, 100%. This is your health, this is your body, and these surgeries, whether it's done robotically or in an open approach, I mean, they come with a tremendous amount of risk. So it's very important. Yep.
Doc, thanks so much. Thanks
Absolutely.
to both of our guests for being with us today. Thanks to our viewers and your great questions. We'll see you back here on Monday. Coming up Monday on the Morning Medical Update, a pea-sized gland that affects so much. When the pituitary malfunctions, it stresses out your whole body. I'm Jessica Lovell on the next Morning Medical Update. We explore Cushing's disease and the symptoms that can confuse doctors and force patients to push for answers. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.